10 silent diseases that can only be identified through testing. Number 1. Kidney diseases. Chronic kidney disease, CKD, is a serious health problem that affects the kidneys, which are vital organs for removing toxins from the body and maintaining the acid-base balance. This disease develops rapidly and frequently shows no symptoms at first, building to a critical stage that can totally impair kidney function and result in severe consequences, including coma. On the other hand, CKD has a good prognosis and a high treatment success rate when detected early. Exams like blood creatinine levels and urine analyses, which are important markers of renal function, can help identify kidney problems early. A nephrologist should evaluate these tests so that they can determine the best course of treatment. Even though there isn't a permanent treatment for chronic kidney disease, early detection is vital, highlighting the need of routine health examinations in preventing serious problems. Number 2. Cardiovascular diseases, hypertension and cholesterol. One of the primary causes of stroke, CVA, is problems from disorders like high blood pressure and cholesterol, which are vital for the heart and blood vessels. Regular blood testing can detect excessive cholesterol, one of the most serious silent illnesses, and if recognized, a specific therapy can be recommended. Similarly, testing blood pressure, which is done by medical specialists using the right equipment, identifies hypertension, another important risk factor. These diagnostic techniques highlight the value of routine medical follow-up and attention to health conditions that frequently go undiagnosed until they cause serious complications. They also enable medical intervention in the early stages, which is crucial to avoid more severe consequences like stroke. Number 3. Colon cancer. Colon cancer is a sneaky illness that frequently progresses silently, without exhibiting clear or distinguishing symptoms in its early stages. This makes it easier for the disease to spread undiagnosed, because symptoms, when they do appear, are frequently mild or easily confused with other illnesses, making early diagnosis difficult. Early discovery of this kind of cancer is crucial, since it can greatly improve the prognosis for this type of cancer, according to the National Cancer Institute, INCA. It is advised to do a number of tests, such as radiographic investigations, endoscopic operations, laboratory testing, and clinical evaluations. To establish the existence of the condition, a biopsy, a process in which a tissue sample is taken from the suspicious location for pathological analysis, is frequently utilized. This diagnostic technique highlights the requirement of medical attention to detect and intervene in the disease as early as feasible. It is essential for determining the presence of colon cancer and starting suitable treatment. Number 4. Osteoporosis. Another condition that typically goes unnoticed is osteoporosis, which only becomes apparent following a mildly traumatic incident, like a fracture from a non-severe fall. Estrogen is a hormone that is crucial for preserving bone density, and its decline is the main cause of this illness. The main indication of osteoporosis is the pronounced brittleness of the bones, which thin and fracture more easily. A specialized test known as bone densitometry is used to diagnose it. It measures mineralization and bone density, while also evaluating the presence of calcium. Examination is essential for identifying the condition and enabling the implementation of therapeutic strategies aimed at strengthening bones and preventing fractures. Number 5. Liver diseases. Because it lacks particular symptoms in its early stages, hepatic steatosis, also known as fat accumulation in the liver, comes into the group of silent liver illnesses that are difficult to diagnose. This ailment, which is defined by an excess of fat in the liver cells, can progress without obvious symptoms, making it challenging to diagnose until symptoms do appear. When symptoms do appear, they frequently resemble other medical conditions. This clinical resemblance may compromise the chances of an early cure by delaying proper diagnosis and therapy. Not only is early diagnosis of hepatic steatosis essential for successful therapeutic intervention, but the condition also dramatically raises the risk of cardiovascular consequences. Specific blood tests that evaluate liver function are used in conjunction with imaging techniques like computed tomography, magnetic resonance imaging, and ultrasound to diagnose hepatic steatosis, since these methods can detect accumulation of fat in the liver. The necessity of diagnosing and treating hepatic steatosis early on in order to prevent more serious complications highlights the significance of routine examinations and medical follow-up. Number 6. Glaucoma. Glaucoma is a dangerous condition that damages the optic nerve in the eye and is one of the main causes of blindness in the globe. Glaucoma is known for being silent in the early stages and for progressing without obvious symptoms. Thus, vision loss can happen gradually and irreversibly before it is noticed. Regular ophthalmological exams are crucial because the absence of visible symptoms in the early stages of the disease makes early recognition more difficult. The ophthalmologist measures intraocular pressure during these examinations, which is a crucial diagnostic tool for glaucoma. While glaucoma cannot be cured, early detection and treatment can slow the disease's course and reduce the chance of permanent vision loss. Thus, keeping an eye on eye health and getting regular expert exams are crucial to preventing the more serious effects of glaucoma. Number 7. Prostate cancer. Prostate cancer is one of the most common tumors in this group. It is primarily found in men and is located in the gland juncts opposed to the bladder. Its insidious nature stems from the fact that, in its early stages, the disease is largely silent, making early diagnosis difficult without specialized exams. The PSA, prostate-specific antigen, blood test and digital check are highly advised for early detection, especially for those over 50. Prostate cancer and other silent disorders are discussed, which emphasizes how important it is to get regular health checks. As people age, the importance of these examinations increases since they are intended to identify medical disorders early on, which can lead to more serious stages if left untreated. Thus, the application of a regular medical evaluation is a crucial cornerstone in the avoidance and efficient treatment of illnesses, guaranteeing a better standard of living and overall well-being, particularly in old age. Number 8. AIDS. Acquired immunodeficiency syndrome, or AIDS, is a dangerous illness that falls under the category of sexually transmitted diseases, STIs, that is brought on by the HIV virus. It can spread by unprotected sexual contact, contaminated blood transfusions, and other methods involving the exchange of contaminated bodily fluids. HIV can assault the immune system, killing off T lymphocytes and other defense-related cells. This greatly raises the risk of secondary infections, including pneumonia and hepatitis, among others. Because AIDS is frequently asymptomatic in its early stages, one of the most concerning elements of the disease is the potential for virus carriers to spread it without realizing they have it. This emphasizes how crucial it is to always use condoms as the first line of defense in every sexual encounter. In order to aid in early detection, it is also advised to take the anti-HIV test about 30 days following any possible encounter to the virus. Even though HIV/AIDS is still incurable, advances in treatment have made it possible for co-positive individuals to live much longer and in better health. These increasingly effective treatments are essential for halting the virus's spread within the body, providing hope and ongoing progress in the management of this difficult disease. Number 9. Diabetes. Diabetes is a metabolic ailment that affects 540 million people worldwide, or over 7% of the total population. There are two primary forms of this disorder: type 2, which typically develops and is diagnosed later in life, and type 1, which is typically diagnosed in childhood. Increased thirst, frequent urination, and weight fluctuations are just a few of the subtly and progressively progressive symptoms of type 2 diabetes, making it especially sneaky. Because the symptoms are not frightening, many patients with the condition go years without receiving an official diagnosis. The consequences of delayed diabetes diagnosis and treatment are numerous and severe, including increased risk of serious complications, tissue necrosis, loss of vision, and damage to essential organs. As a result, once the illness is identified, it is critical to implement efficient management that includes consistent physical activity, a balanced diet, and routine blood glucose testing. These actions highlight the value of taking a proactive approach to one's health and well-being by helping to prevent more serious consequences from developing from diabetes, as well as controlling its progression. Number 10. HPV. The most prevalent sexually transmitted illnesses, STIs, is HPV, spreading by contact with contaminated surfaces as well as through sexual interactions. Because HPV is primarily quiet, infected persons may unintentionally spread the virus without realizing they are infected. This makes early detection and prevention crucial in the fight against HPV. Women who have HPV may not exhibit any symptoms at all, but in certain instances the virus can cause warts or polyps to appear in the urethra, anus, uterus, and vagina. Given that HPV can progress into more serious illnesses like cancer, especially cervical cancer, early treatment is crucial. Regular testing, such as Pap smears and colonoscopies, is advised for prevention, as these procedures are essential for the early identification of cellular alterations suggestive of HPV infection. In a similar vein, males who have HPV infection may have warts on their penis, scrotum, or anus, while many may continue to show no symptoms. To lower the risk of transmission, prevention through persistent condom use in all sexual contacts is essential. Men who fear they may have been exposed to the virus can also get specialized tests, like a peniscopy. Therefore, lowering the prevalence of this STI and its potentially serious health implications requires raising knowledge of HPV, preventing it through safe sexual behaviors, and emphasizing the value of routine exams. Thank you for watching. Don't forget to subscribe to the channel. See you in the next video.